So welcome everybody. My name is Arnie Greenland, and I'm the moderator for this webinar. And first thing I'm trying to do is make this larger. See if that works. Just one moment, full screen. Well, I'm just not going to take the time now. So the slide you're seeing on is the information about the practice section. We do a lot of things. So I just wanted to quickly summarize what those were. Of course, we are the organization that runs some of the major competitions, the Edelman Award, Daniel Wagner Prize, and the UPS George D. Smith Prize. So some of the most prestigious Informs prizes. We also have two webinar series, this one, as well as one called Applied Analytics Success Stories. And we switch each month. So since this one is in May, the next one in the other series is in June. That has not been announced yet, but you can go to that website that's shown there. And if you can't actually do that now, this is going to be recorded. So if you don't know what that website is, you can come back and see it. Similarly, this one, which is going to be next in July, we have not yet made that announcement either. But we do know that the virtual networking happy hour is going to meet essentially a week from today at 5 p.m. You can go to the website that's shown here to register. We do lots of other things, of course, with tracks at various meetings, newsletter, lots of other information. So very active organization. So please check out these websites. Without any further ado, I'm going to stop sharing my screen and introduce our invited guest for today. It is Janine Kamath, who is the international, you know what, Janine, I'm going to let you introduce yourself because I unfortunately didn't put it in front of me. So I'm just going to pass it on to you, and I'm going to let you introduce yourself. Thank you very much.
I will just say, Ani, can you just give me a thumbs up? Can you hear me okay?
Yes.
Yes, you can. Thank you so much. Well, thank you, Ani. I just will say that I'm an executive director at Mayo Clinic with Mayo Clinic's international business. I've had a chance to work, as many of you might know, in analytics and systems and process engineering, management engineering, operations research for many years. And I'm really excited that I have the privilege to be able to share a little bit of my own learning, my own growth with all of you. And I just want to say this, it's really important for me that it's not just about me sharing through this, but also about me learning, and we all learning from each other. So thank you, Ani, Beth, and Informs for the opportunity. I appreciate it. What I'd like to do is that I'd like to mention that what I'm going to share with you today is focused a lot more on healthcare, as you can imagine. However, I believe that it's very replicable to other industries and also to our academic organizations that I believe will definitely benefit from all of the learning we've had so far. And I always am looking to learn and return. I always like to start with the possibility. And as all of you know, with the incredible innovation and change agility that's going on all over the world, I would really like to start with what is truly happening from a possibility standpoint in healthcare, and then we'll work backwards from there. Just a little glimpse into that. So Beth, can I just request you to share a quick video so everyone will get a chance to sort of see what that possibility might be. Thank you, Beth.
According to AI experts, brain implants could make learning obsolete in less than 20 years. Instead of reading textbooks or going to school to gather information, we'll have devices in our brains that download information on demand. That may sound like a lot to achieve by 2040, but based on where current technology is, AI expert Nicholas Karanos says the timeline isn't out of reach. A brain implant, also known as a neural implant, is a device often placed on the surface of the brain. It's capable of communicating with your neurons, recording their activity, and even telling them how to behave. One of the most common applications is deep brain stimulation, where electrodes are implanted into the brain to stimulate different areas and reduce the symptoms of brain-based disorders, such as Parkinson's disease or epilepsy. More than 150,000 people globally have received such an implant, but the implants can control neurons in other parts of the body as well. Doctors have used neural implants to stimulate the spinal cord, allowing individuals with paralysis to walk again. Amputees equipped with the implants were able to control robotic prostheses using nothing but their thoughts. Then there's a host of examples that are straight out of sci-fi novels. For example, a team from the University of Pennsylvania's Computational Memory Lab successfully enhanced people's memory capabilities by stimulating brain regions using electrodes. Perhaps one of the most well-known brain implant companies is Elon Musk's Neuralink. The company's ultimate goal is to merge computers with the human brain so that human intelligence can keep pace with advancements in artificial intelligence. Neuralink uses threads in the brain connected to a 4mm chip called the N1. The company recently released a video that appeared to show a 9-year-old monkey equipped with the N1 chip operating a game of Pong using his mind. The N1 chip is just the first step for Neuralink. The team is also developing Neural Lace, a brain-computer interface technology. The ultra-thin mesh will be inserted via a tiny needle and encompass the brain. The goal of Neural Lace is to enable humans to upload and download information directly from a computer, much like Neo in The Matrix. Neuralink isn't the only company making headlines in the field. Led by CEO Ramses Al-Kaid, the Neurable team revealed the world's first brain-controlled VR game in 2017. Their device is a wearable that uses 7 scalp electrodes to record electrical signals in the brain. Mindex is another brain implant company that aims to create a look and think interface for next-generation spatial computing applications. Users will be able to interact with computers using smart glasses that link with the human brain. The glasses will let wearers access information with a single thought. No more rummaging for your phone to Google a burning question. This is all just the beginning. There's a long way to go with this technology before we all have the option to get chipped, and many hurdles to overcome. After all, major elective brain or spinal surgery is incredibly risky. Still, engineers are working on tiny implants, such as the 0.25 square millimeter neurograins, as well as implants that can travel to the brain via the bloodstream, eliminating the need for open brain surgery. Considering all of this, AI expert Nicholas Karanos may be correct. In the next few decades, would you want to make your brain part machine?
All right, let's confirm this time. Can you see the slides?
Yes.
Okay, great, super. Thank you, Beth. No problem. We'll just post the video. So what I'd like to do is the video, once, if people get a chance, I would really encourage you to see it. It gives you a great sense for what the possibilities are and all the innovative ways in which the people are trying to change healthcare. So really my main thought here is that the future is really now. There's a lot of change happening on all fronts. And what I'd quickly like to do before we go to the questions is to give you a bit of a feel for the healthcare environment, Mayo Clinic, our analytics journey. All of us know talent is just such a significant piece of what we are all working through. Some of the critical considerations to keep in mind, and then Ani, I'd be so excited to open it up for discussion. So with that, Beth, if you could just move to the next slide, please. So you had a chance to at least hear the video, if not see it, but you got a feel for how critical data, technology, analytics, et cetera, is for us to move forward, and particularly important in healthcare. I'd just like to point your attention to the number 3 in 2030 and the bottom of it. And you'll see that granted, this was done a little before COVID, and I can just imagine that COVID has just moved this forward even more significantly. And you can see the increase in the impact in terms of the investment, $1 trillion, and the change that's going to happen between 2020 and, just happened between 2008 and 2030 in terms of the investment from 2 to 16 trillion. So the opportunity is just significant. That next slide, please. The other thing, the healthcare industry is also dealing with many different things, but I wanted to point out one thing, and that is the Internet of Medical Things. You can just see there's wearable devices, there's devices that people carry with them, it's on their phone, it's mobile, tremendous amount of data that we're going to see coming through. And how do we really assimilate this data? What do we do with it? And how do we manage and integrate it? So this whole aspect of the Internet of Medical Things is a pretty significant piece amidst others that we in healthcare are trying to really work through. Beth, next slide, please. I wanted to take a moment to share with you the healthcare ecosystem and what really we're dealing with related to data. I want to emphasize that, and you'll see it throughout my quick sort of preamble and talk here, and that is the focus has to be centered on the patient. Consumerism in healthcare has significantly increased all over the world, and COVID has only made that, even more sort of apparent. The kind of data that we're looking to assimilate and to work with, just quickly at a high level, you'll see this financial data coming from all sorts of accounts, from savings accounts, insurance companies, banks. They are all changing and restructuring. We have social data that is coming through to us related to patients, their families, the community, just so many different variables from there. You'll see as I go clockwise, patient-generated clinical data, a lot more, as I talked about, with the wearable devices, monitoring tools, home health, things that are going on, virtual clinics, just coming from every which way. Health and wellness data, extremely important, and we recognize how critical that is in preventive care. So we've got to definitely keep that in mind. And then the last piece is the provider-generated data, which we're often very familiar with, but it's only one piece of a whole ecosystem. And then you have the patient, of course, which is at the center of everything. And I just wanted to share this with you so you get a sense for the kind of advanced analytics planning, sharing, creating platforms that will help us manage this. So many possibilities and opportunities that our consumers and providers are going to expect. So just wanted to give you a quick glimpse of the healthcare ecosystem. Beth, if we could go to the next slide, please. So in summary, the 5 trends, and there are more, but I just share with you a few that are shaping the future of healthcare. It's clearly a data-driven future. We've talked a little bit about the ecosystem focused on the individual. Individualized medicine, personalized medicine is becoming a huge piece of delivering healthcare. Digital, I don't have to share with you how important that's becoming, but I want to take a moment and focus on the data liquidity part. What that really is moving data through the entire healthcare system in a much more easy, agile, and secure manner. Security, privacy, confidentiality is just a very crucial piece. Trusted intelligence coming out of all of the data that we're collecting that will drive participation, engagement, much better outcomes at a lower cost. And finally, a future-ready culture and workforce that embraces digital, because this is the way the world is moving in a very deliberate and agile manner. Beth, the next slide, please. I want to share with you a little bit about Mayo Clinic to put things in context. And Beth, if you'd go to the next slide, please. So Mayo Clinic, and many of you may have experienced the clinic at our different sites. The main sort of footprint is in Rochester, Minnesota. There's a huge health system that surrounds Rochester, Minnesota, about a 200 to 250 mile radius. We have a destination medical center in Scottsdale and Phoenix in Arizona, as well as in Jacksonville in Florida. And a number of other affiliations across the country, but this is really sort of the main footprint in the United States. I won't go over details of the numbers, etc., but it's suffice to say it's a large organization spread across the US with just much more of a focus on serious and complex care. We definitely do a fair amount of primary care, but it's really the serious and complex care that is a big part of Mayo Clinic's offering and delivery. Beth, if you could go to the next slide, please. Mayo Clinic, I'm part of this footprint. It has a significant global footprint as well. And you'll see Canada, South America, of course, as these two countries sort of, border the US. Moved a fair bit to London. We have a outpatient clinic in London, a very large outpatient, inpatient healthcare delivery system in Abu Dhabi. And you'll see a number of other affiliations across the world. We're just in the throes of finalizing a few more key markets like Australia, and we'll move in much more deliberately across the world to extend Mayo Clinic's care to our patients in other countries. To me, coming from India, that's of special note because it would be so wonderful to extend that care to our patients and others across the world. So that's the global footprint. And Beth, if we could go to the next slide, please. One of the key areas of focus for Mayo Clinic, and this is really important because this is what frames our whole analytics digital platform strategy, amidst other things, is what we're calling the Mayo Clinic 2030 Bold Forward, really being bold, innovative, and moving forward with agility. And if, Beth, you go to the next slide, I'll share with you a little bit what those key aspects are. You wouldn't be surprised that cure is a very critical part of what we want to do with our 2030 plan. New therapies, creative ways in which we will deliver. COVID has absolutely shown us how critical that is. So to make happen in a preventive, emergent, as well as agile manner. Connect is where we will focus on really bringing digital and virtual care to the world. We've made a significant investment and created what we call the Center for Digital Health. And there's going to be a lot of work in the center to convert and transform what we're doing in the way we deliver care and look at the opportunity to, they're calling it now Physital, if I remember right. It's the physical and digital coming together to deliver care that is patient-centered. Our platform is the key component that fits within Transform. Mayo Clinic will be the first healthcare organization, or is the first healthcare organization in the world to look at delivering care through an integrated platform. We're learning as we go, but this is a very significant part of our 2030 strategy. And we couldn't do any of this without having the best people, creating an environment that fosters innovation, and that we're very sensitive to multiple different things happening in the community and in the world today. And I'll briefly talk about them. Beth, if we could go to the next slide, please. So maybe in terms of the whole digital connect, transform piece, Mayo is pursuing more of an approach that is a constellation of technologies. which includes, as you can imagine, robotic process automation for our call centers, for some of the care that we deliver. And this is a very powerful technology that will help us. Document intelligence, using a lot more templates and tools from which we would automatically be able to extract, store, and use data in a structured format. Virtual agents, our patients and our consumers are expecting to be able to do things in a way that they know they're working with Alexa and Siri and everything. So they would like to have some virtual agents to help them. Natural language processing, critical for us. Physician notes, nursing notes is a very important piece. They are textual, and how do we really leverage data from these very rich documents? Machine learning, I won't go into the detail of that. For our artificial intelligence and a whole bunch of other things, machine learning is absolutely critical for us. And the last one was, we generate so many images, as you can imagine: radiology, cardiology, GI, dermatology. Leveraging these images and using them to deliver innovative and differentiated care is really, really critical. So Beth, if you can go to the next slide. Quick sense for a few of the technologies. We are marching along very deliberately through the analytics maturity cycle. I'm not going to go into detail of this in the interest of time, but you'll see that move from creating a deliberate infrastructure and business intelligence to being able to predict and prescribe from an analytics perspective is imperative for us. But maybe if you would go to the next slide. I also want to put out this piece that I'm guessing, and I think I know all of you are balancing as well, these new operating models that are really going to have us find the sweet spot between what you have on the left, which is standardization, reusability, best practice, all the good things that I'm a systems engineer and an operations researcher as well by background. That is really important for us. However, we all know the world is changing and our consumers are driving, as well as key stakeholders, agility, autonomy. They want easy access 24/7, mobile. They want us to be extremely responsive to their needs. So it's how do you find the sweet spot in delivering healthcare for us, and for you delivering any product or service that you're involved in, or education? How do you find the sweet spot? And we're continue to grapple with it. Beth, if you could go to the next slide, please. We'll talk a little bit more in the next stage of during questions, but one of the key things that we've had to do at Mayo Clinic and in the department that I've been part of is raising our game. Talent is crucial. And some of the techniques and strategies we've used is, right from partnering with schools and others for talent acquisition, advancing our curriculum internally, and partnering with groups like Google and Coursera, et cetera, allowing better and easier access to data through data marts and other opportunities, bringing in best practice tools and methods that we can use in a repeatable way, and also using them as reusable assets, developing communities of practice where we talk about this on a regular basis. Experimentation has been significant for us. And the other thing in our raising our game is, how can we be early learners and early adopters of this entire journey of digital data, analytics, et cetera. But if you can go to the next slide, please. I also want to share with all of you that in this sort of, race for talent, some of the ways by which we're looking at developing our professionals is this T-shaped professional model, a horizontal which includes the core business competencies, clearly technical competencies, but also the vertical, where we have people with domain and specialty competencies in the areas of engineering or AI or robotic process automation or applied analytics. So a lot of core domain specific competencies that we're going to need to function effectively in this digital world. Beth, if we could go to the next slide. I think I have 2 or 3 more and then we'll open it up. I'm not going to go through the details of this, but I just wanted to give you 1 or 2 quick examples. Here is an example of using an artificial intelligence algorithm to really detect low ejection fraction from ECGs. That is a standard primary test that we would do. Early detection of this low ejection fraction so that we can treat patients in a much more proactive manner and reduce the risk of them progressing to symptomatic heart failure. It's been a tremendous value added piece for us. We've, our clinicians and IT and data colleagues have been able to identify this algorithm and work through it and found it effective. But if you go to the next slide, Beth, you'll see, to me, applied analytics, applied AI, applied digital is crucial. If it doesn't reach the consumer, it really doesn't give us as much value as we would like to. So we had to put around this an integration of the algorithm right into the electronic health record. We had to do a fair amount of work with change management to address concerns of, is this really, something I can make my diagnosis on? What are some of the things that I need to be thoughtful about? Integrating this with the workflow real time for the patient and the provider, and augmenting the clinician's decision-making without additional administrative burden for us was really important. And then we had to work on how do you scale the solution in a way that it's sustainable and not a one-off. So Beth, if you go to the next slide, please. Here is another example of how we have used applied analytics to work through staffing, managing capacity, and developing a patient-centered dynamic itinerary that we can change at any point in time through the journey at any of our points of service so that we can accommodate whatever changes have been made by the provider and patient in their discussion. So this has been a phenomenal application for us in the way we have optimized that patient experience in our outpatient setting. Beth, if you go to the next one, please. Here is another example of using IBM's Watson, which when we first implemented it, without putting around it the kind of workflow, analytics, value-added pieces, it did not go far. But once we were able to integrate the power of the clinical trials matching algorithms with Watson, along with the workflow and the way our clinicians would treat patients with who they could put on a clinical trial, it would pop right at the point of care so that our clinicians could decide along with the patient that this is a trial that I would like to put the patient on. It dramatically decreased the amount of time for us to get patients on a clinical trial because we were able to pull this all together in a much more seamless manner. With that, Beth, I'll close. If you can go to the next slide, please. Just keep going, Beth. Thank you. I will be remiss if I don't share a little bit with all of you about our platform capability. Where we are today is really looking at using AI, analytics, and connecting the various stakeholders with care that would help to deliver care. Some of the areas in which we've had our initial foray is in really looking at how can we provide advanced care at home and decrease the amount of time our patients have to spend in the hospital because they would like to go back to their homes. Developing a clinical data analytics platform to really be able to do advanced analytics, and then clearly a remote diagnostics and management platform. I want to highlight here that one of the key ways in which we're moving with agility as well as with a certain degree of confidence, is through partnerships with other organizations across the world. So just to give, partnerships has been a very crucial strategy for our platform. Beth, if we could go to the next slide. So in closing, I would like to share with you a few critical considerations that we can talk about more. And one is that as we're looking at analytics and a digital world, ethics is become an extremely important piece that we're grappling with and working through. Data privacy and security, I don't have to speak much about this. All of you have a pretty good feel for the implications. Inclusivity and accuracy, very, very important, and has COVID and the whole Me Too movement, et cetera, shown us how important equity, inclusion, and diversity is. The social determinants of health, be it things that our family situation, our economic situation, our cultural situation, all are key social determinants of health, and the very important piece of cost. What do we do in terms of how we manage value and cost and that equation? So in closing, if you go to the next slide, Beth, I think what we often think about as we work with analytics and technology, et cetera, we think success is just this pretty neat linear, growth that we experience. But as you perhaps have, our experience has really been that it's a lot more squiggly than we imagined it would be, but we need to continue to work through it to get to the other side, which we truly believe will be patient-centered and will be successful for all of us and for Mayo Clinic. So with that, Ani, I thank you so much for the time. I'm happy to take questions. Let's jump right into our discussion. Beth, I'm good if you want to pull down the screen. Thank you.
Okay, so great introduction to Mayo and the plans for the future and the challenges that you've already been able to accomplish. I usually spend maybe about 15, 20 minutes, so I'll watch the time, so we'll sort of leave time for the audience. Before I start, I want to tell those who are on the call, if you have a question, please type the question into the Q&A location, which you'll find at the bottom of the Zoom window. And then when it comes time for the questions from the audience, that I'll look there for those questions. Okay, so I'm going to start our conversation by asking you to share with the listeners today your analytics journey in the many years you've been at Mayo, and in particular, how your role and that of analytics has evolved in that time.
Sure, thank you, Ani. I will say in the time that I've been at Mayo and sort of exposed to healthcare, Ani, it's, and it started early 90s with this journey of at Mayo Clinic in particular, we had very sophisticated, good manual systems. And so we felt pretty comfortable overall, I would say for longer than maybe we should have, just because the manual systems were so robust and so strong. So early 90s, we really moved into this journey of we've got to leverage technology. We've got to find a way to make this much more accessible to the multiple stakeholders. So I think we moved into this whole world of the electronic health records and spent a fair amount of time there. But as we learned in that journey, Ani, we then moved to this whole piece of digital and analytics, learning from organizations like Informs and others. What is it that we really need to do to harness all the information that we'd collected? Because it was very vertical and a lot more in silos, not integrated. How can we move forward to truly get value out of all of this information by moving it into a much more structured, integrated, thoughtful sort of, manner? But I will just say, Ani, in closing right now, the expectations from our stakeholders, our consumers, our patients across the world is extremely high. They expect us to be able to deliver in a digital integrated manner. And I will just say we're on a journey, we're learning as we go, and it still is a little bit of chaos just because we're balancing high expectations with agility and a whole bunch of other components that we need to take care of, like data security and privacy and confidentiality. So lots of progress, lots of work still to do, and I would say very, very real-time learning.
Okay, thanks so much. So I'd like to focus a little now on the analytics organization that you and your colleagues have created in particular. So would you share your approach to building this workforce? And for example, are you hiring or growing the talent internally, or a combination of the two?
Definitely a combination of the two, Ani. We're growing internally, but hiring people from the outside for sure. And it's not just localized, let's say, to the United States. We're looking at opportunities across the world to bring in talent. So it's a combination of both. We're also looking at partnerships. I think if we need to move with speed and deliberation, just doing it on our own is not going to be the way to go. And so clearly partnerships is another very important piece in this journey. I would also say we're looking at creative ways in which we, in this vein of partnerships, that we partner with. If you look at really reversing, a more of a reverse sort of approach to this, partnering with our academic colleagues and schools to be able to see what we could do to really engage our young colleagues and be able to move that sort of talent forward as much as possible. And then I briefly alluded to it in my presentation, Ani, but we're doing a lot of work internally to move with agility early to really grow the talent. And some of the things that we've been leveraging as we work through this is, clearly I mentioned education, communities of practice, experiential learning. That is really important. So getting people into projects right away. And then the other thing is crowdsourcing. How can we learn by all of us jumping in and crowdsourcing so that we can grow? So to your question, combination, leverage internal and external across the world, and come up with creative ways in which we can move forward. But ultimately, we've got to have 70% of our learning comes from experience.
So could I maybe just focus in a little? Can you give the audience a little understanding of what are the skill sets, specifically the analytics skill sets that you're looking for, that are the most prized or the hottest areas?
So some of the analytic skill sets, Ani, will clearly be, and it's a variety. It would be those who understand data, right? All about, it's everything data. Data structures, data security, data privacy. How do you acquire everything data? That's a really crucial piece. Another skill set will be how do you apply the analytics models, knowledge, experience, leverage that you gain? How do you move quickly from discovery to application? Because that's going to be really important. People who have understanding of how do you use analytics to enable informed decision-making? Because if we have to move with speed and deliver services, our consumers are expecting it, you need to make informed decisions. So that's another piece. The other one I would say, Ani, is visualization. Often when we need to present to our senior leaders and others, we could have all this information, very sophisticated modeling. That's another area. Modeling is really, really important. But visualization and how do you deliver what you have identified or what the model demonstrates in a way that you can move to informed decision-making very quickly. So always driving from the outcome, the value, the goal, making, analytics in my mind is a means to an end, an important means to an end, but we have to keep the end in mind. So I don't know if I answered your question, Ani.
They're very good. Absolutely. So my next question is, what has been the impact and commitment of senior level management at Mayo in terms of your ability to be successful?
Significant. I think as our leaders created the Center for Digital Health, recognized the power of analytics, Ani, it's been significant. I have to give them that. Really, they've appreciated the importance of data, how modeling and analytics really helps us to make decisions, helps our patients at the end of all of this. But one of the things I'd like to put forward, Ani, for all of us is the senior leadership, very important. But to us, there's also so many critical stakeholders. Our physicians, our nurses, just to give a few, our patients themselves. And to us, as we've gone down this analytics journey, it's very, very important to bring all these key stakeholders along. It's not just senior leadership. You've got to bring all these key stakeholders along. And I won't remember this African proverb, but somebody will be able to remind me. It's, if you want to go far, you need to take everyone with you. But if you want to go fast, you'll have to go it alone. But you really want to go far. So I would say we need to bring in all these key stakeholders. But the support from leadership has been very, very strong. And I think we all recognize that it's a business imperative. Analytics, data, and digitization is crucial.
Okay, thanks so much. Now I'm going to sort of ask maybe a personal experience. What has been the most challenging problem you have faced? And it could be either a technical or a management problem in your role within Mayo.
So I would say, Ani, I know you're going to allow me more than one.
Of course, yes. You can do more than one if you like.
I would say, to me, it's really moving from discovery to application. It sometimes, I think what happens is we get so caught up in, and that's not wrong, but it is what it is. We get so caught up in the modeling and everything that we're doing that sometimes we forget that we've got to move horizontally. So to me, it's how do you really move quickly, deliberately, and effectively to application and bringing value to the ultimate consumer. I just think it's still difficult. There's so many pieces along the way, barriers along the way. So that's one. I'll chime in with just a few more, Ani, in terms of my experience. And we've talked about talent. It's not just today. I truly believe that talent is going to become a gating factor for us. And I think all of us professionals in forms, organization, and others, we've got to find a way to creatively deal with this. The other thing is truly making data the kind of resource that we're looking for it to become. There's a lot of holes there, and I've talked about it. Accuracy, cleaning, integration, structuring, all of that. Ani, time. To me, at this point, time is really one of our most precious resources. There just isn't enough time to do the good work we all want to do and deliver, and how do we deal with that? And then the last thing that I'll say to me is, it's really COVID and other things have brought front and center is life. Life happens. And we have to keep that in mind. We cannot forget that we have to work through life, be it COVID or supply chain, or now we're hearing the world is on the brink in many places of hunger, just a whole bunch of things that happen, and life happens and must play a critical role in the way we model and we deliver potential solutions. Okay,
thank you. Great answer. This is a question that I've heard from a number of attendees that they're interested in how the featured organizations approach managing analytics projects successfully. So can you please comment on how Mayo seeks to assure successful analytics projects? For example, how do you measure success, manage scope creep, and effectively communicate and engage with your internal clients?
That's really a good Good question, Ani. In my mind, I'm thinking, Ani, can you just, sorry, I suddenly lost my screen. Can you just repeat a piece of your question again? Sorry, Ani.
No problem. So I said, can you comment on how you assure successful projects, in particular, measure success,
Got it.
manage scope creep, and effectively communicate with your internal clients?
Thank you. Thank you for that. So some of the ways in which we manage that, Ani, is this may sound cliche, but I just want to emphasize it. For us at Mayo Clinic, it's really, really important. And for those who have experienced Mayo, you'll sense it, is that the needs of the patient come first. So whatever we do, we anchor it in that value when we decide to take on projects or anything we need to do. The second thing I would say is the way we manage scope creep, additional projects, etc., is focus on the strategic priorities. Very key. We don't have enough people to deliver on everything that people would want. So focus on the strategic priorities. I don't want to forget emergent as well. I'll just share with the group, Ani, that in our engineering and consulting team at Mayo Clinic that also does analytics, etc., we had worked on 213 projects in 217
Wow.
days when we had COVID. I mean, it was just tremendous. So emergent, move quickly to application and value. That's one of the ways in which we deliver. I will be honest, I think we have work to do in how we learn to measure our success with analytics. What are the metrics? How do we monitor success? How do we measure? We're learning as we go, but one of the key things is our metrics need to integrate with the metrics of the organization. It can be independent metrics, that alignment. Learn from and recognize failures. In my mind, Ani, it's not a bad thing. We learn from it and we have to embrace it. And the last two things that I'll say in terms of how we really ensure success and alignment with the organization: always understand the business context. We spend a lot of time learning about healthcare just so that we know whatever we deliver is within the context of the business. And the last thing I'll say is learn tangentially. From startups to mature organizations across industries. And Ani, I'd like to close by saying I have learned so much from the students that I mentor across multiple schools. They have really taught me so much about the future. So learn tangentially from every touch point. And that has been very helpful for us with analytics and a lot of other arenas as well.
Very, very interesting answer. And I'm frankly consistent with my own personal experience. That is that focusing on the business, knowing the business better than your client, if you will, and understanding how they measure success.
Mm-hmm.
That those are really critical aspects of success in the long run for these projects. So your answer was very consistent with what I think already. So we're probably maybe
it looks like we might have a couple of questions in the chat. I don't know if you want to take those.
We could start on those. I still have one or two that I could come.
Yes, please go ahead.
Why don't we let me see. Here's the last one I would like to maybe take a moment on.
Sure.
So there's a lot going on at companies in healthcare over the last few years. Obviously, COVID was a key driver. Yeah. And it makes sense that analytics should be a major part of that, future.
Right.
So can you provide some insights on how your work has impacted the transition that Mayo is going through right now?
Yeah, sure. Happy to do that. One thing I want to emphasize again, Ani, is value of the work that we deliver, that integration with the strategic priorities. You don't want to be working on initiatives. I shouldn't say you don't want to be working. You got to be thoughtful about working on things that are not aligned with the strategic initiatives of the organization, because there's too much to do with just too little resource and people. So clearly that strategic piece. The other thing I encourage my team and others to do is showcase the value of analytics. You know, share how analytics has really added value, use stories, talk about different areas. For us, it would be in operations, research, education, practice. Bring out those stories, bring out those examples where analytics has made a difference. People are busy, but you need to show how you have made a difference within the context of the business. I've already talked about moving to value as quickly as possible.
And I certainly want to thank you for your time and preparation. Really interesting. And I don't know if you saw the text. Beth says that the staff, the technical staff, will be able to incorporate the video into the posted video for this session. We'll be able to edit it so that, you know, that'll be available for anybody who wants to go back and watch the video, as well as you know, the majority of this presentation, which was fine until the last couple of minutes. But I want to thank you very much for fine in terms of the audio. That's, of course, it was all fun. The whole thing was wonderful. So thank you so much for your time. And we will look forward to posting the video of this event and any other information that's needed. I wish you well, and thanks for everyone who participated in the webinar today.
I really appreciate it, and thank you.
Bye-bye all.
Bye.